Hey everyone, this is Ben with Cholinergic and in this video I'm going to talk to you a little bit about some of the signs and symptoms that you can experience when you have cholinergic urticaria. And first I just kind of want to briefly talk about the difference between a sign and a symptom. A sign is something that someone can objectively see in you. So in other words, if I have just a patch of red hives on my skin, that's a sign because someone can come up and they can objectively see that on my skin. A symptom is something that you feel. So for example, itching, someone can't really see that you itch or that your skin's burning. That's just a symptom that you feel. So that's the difference between those. And I'm just going to talk a little bit about them. First of all, these symptoms and signs with cholinergic urticaria, they're not going to appear in most cases unless you're exposed to some sort of heat. And that's the issue with it. It's anytime you become hot, you know, it can be taking a hot shower, eating spicy foods, walking into a hot room, exercising, even a strong emotion. If you're laughing really hard or you get upset or anxious or something like that, any of those things can increase your core body temperature. And when that happens, then you're likely to have a reaction. Some people have horrible symptoms and some people don't. Some people have a very minor case and they'll just get, you know, a little bit of redness or a little bit of itching and prickling, whereas some people can have very dramatic signs and symptoms. Their bodies can turn bright red. They can have hives all over from head to toe, very visible hives. They may experience, you know, severe itching. And so it can vary quite a bit. And in fact, not only can it vary among individuals, it can actually vary in one individual over the course, because I've had it where it wasn't that severe and I've had it where it was pretty severe. And these signs and symptoms often appear in the upper portion of the body, like the upper torso, on the arms, the neck, face, chest, back. That's the most common, and it can migrate to the legs as well. And I think that may have a connection with the severity of the hives, because I noticed that when mine were most severe, I would just from head to toe get covered in hives. I'd be scratching everywhere. But when my hives are less severe, I would tend to feel it more on the upper part of my trunk. Again, that can vary. Okay, so let's talk about the signs. Again, these are the things that people can objectively see in you. First of all, you can have flushing. Now, flushing is where your skin turns red. It's when the blood vessels on the surface of the skin leak, and this the symptom that you would feel is burning or itching, and some people may even be asymptomatic. They just may have red skin and it looks crazy, but it doesn't really feel that uncomfortable to them. So flushing is a symptom that I had, and it's one of my first symptoms actually, one of my first signs, and then the symptoms that would accompany that would also be the itching and prickling. You can have wheals, which is just kind of a red raised area of skin, or a fleshly raised area of skin, and that happens a lot when you'll scratch, especially if you have a little bit of a dermatographic urticaria with it, or dermographism as it's sometimes called. And that's if you just kind of scratch the skin, it'll kind of form a really red or maybe a little bit raised area on your skin. So you can have wheals and welts like that. Another sign is pinpoint hives. And again, I have pictures on my website if you want to see some of the crazy looking hives that can form on the body. But most of these are relatively small with this disorder. If I were to try to put a measurement on it, I guess somewhere between 1/16 of an inch to 1/4 of an inch. I know most people use metric units, but I'm using inches here just to kind of give you an idea. If you want to see, you can look at the front cover of my book. You can look at I have a page, Cholinergic Urticaria pictures, on my website. You can go and look at the pictures of what people have uploaded. And another sign you can have is anhidrosis or hypohidrosis. And what hypohidrosis is, reduced sweating function. That's where you can't sweat as much. And anhidrosis is pretty much you can't sweat at all. And I've had both of those throughout the course of my hives, and it can make it difficult because you want to sweat so badly, and sweating will cool your body. And a lot of times when you have this disorder, if you can get the sweat out of your skin, then the hives reaction will stop, and sometimes you can go through a whole day or maybe even a few days of relief, but it can be very, very difficult to get the sweat out. Another sign is fainting. Some people can actually faint if they have a severe reaction. It's less common that happens, but it can happen, and some people have reported feeling very faint or even passing out. You can have increased salivation, where your mouth just waters more. You can have angioedema, and what that is swelling of the tissues under your skin. Some people can get swollen lips, you know, their fingers may swell a little bit or something like that. So that's not really common either, but that can happen along with it. And the most dangerous sign of all is anaphylactic shock. That's something that you really don't want to have. That's when you really, the swelling becomes so severe you can have it in your throat, and your throat can kind of close and you can't breathe as well. And that can lead to death. And some people have reported that. It's not, again, that's not something that's very common with this disorder, but you can get an EpiPen and inject yourself if you ever have an anaphylactic shock. And an EpiPen is just a shot that you can get from your doctor that contains, I think it's norepinephrine, and you can inject that in your skin, and that makes the reaction stop. So if you ever feel like you have trouble breathing or that your throat's kind of swelling shut a little bit or anything like that, you definitely want to talk to your doctor about getting one of those. Now, some of the symptoms that you can have with this, in general, you're going to have an uncomfortable feeling on the skin. Whenever I would just not even have a reaction, I could sometimes just notice sort of an icky feeling on my skin. And of course, it would get dramatically worse when I have a reaction. And I kind of describe it like if you're wearing like an uncomfortable wool sweater or something like that, and you know, it just sort of feels like icky on your skin. It's hard to describe, but I was always a little bit more aware of my skin. And so I kind of had that symptom. Another symptom, of course, is the prickling, itching, stinging sensation. Now, the itching can be severe with this, and it's hard to describe it exactly, but it kind of feels like you're being pricked with a needle, and it stings, but at the same time, it itches, and you can't resist the scratch. Like, you have to scratch. It's just, it stings and hurts that much. And, you know, it can come like sporadically, like hundreds of feelings, hundreds of sensations of that all over your torso, legs, anything simultaneously. And you can just, I mean, you can really start just digging down and trying to scratch yourself to death. It's a horrible feeling. That's what I would look like, by the way. When I would have a reaction, I'd often, you know, sometimes be in the car, be at home, and I would just be scratching like crazy. You can feel kind of a burning sensation on your skin. That would happen a lot of times when I'd have a really bad reaction. I'd have the itching and scratching, and then as it would kind of taper off, my skin would kind of just burn a little bit. And some people feel that. After a reaction, you can feel very lethargic too. And that would happen to me when I would have the really bad reactions. And I would just kind of feel wiped out for the day. I felt tired, like I wanted to take a nap. And you can get headaches after that reaction as well. I would sometimes get a headache. Stomach cramps. I didn't get stomach cramps with my hives usually. That would just be something separate that was associated with the food intolerances and allergies that I have. But a lot of people have reported that after a really bad reaction, they'll notice a lot of stomach cramping. And in addition, some people have reported shortness of breath. And that is something also that, you know, you want to be careful, because if you feel yourself that your chest is really tight, you're kind of wheezy or something, you know, you may have asthma or something in addition to cholinergic urticaria, or it could inflame your asthma. So that's something you want to be take note of. And, you know, you may want to talk about an inhaler or, again, an EpiPen with your doctor if you ever feel those symptoms. And again, I just want to stress that those symptoms can vary. And some people will come and they'll say, you know, I get these hives on my skin when I get hot, but they don't really itch. Well, that's something that some people report. Some people don't get the itching and stinging. They just get the hives when they get hot, and then they'll kind of go away. Some people will get really dramatic flushing of the skin, where their skin will become really red, and sometimes it burns, and sometimes it itches, and sometimes it does nothing. Some people, and you know, you won't get all of those symptoms and signs that I just described. I didn't get a lot of them. I didn't really get salivation or fainting or angioedema or anaphylactic shock or any of those, but you know, you can get those symptoms with it. These symptoms sometimes worsen in the wintertime. So, you know, some people can go through the entire summer. They can kind of get their body used to sweating, and they can go throughout the whole summer without, you know, dealing with cholinergic urticaria. And then when winter comes, sometimes the symptoms will come back. Why does that happen? It's hard to say. It could be because sweating is infrequent. You don't really sweat a lot in the wintertime. Even when you exercise, sometimes it's hard to sweat. And so the fact that you don't sweat means that, you know, your body might go back into panic mode whenever you're trying to sweat. It can appear at any age, like I've already talked about in a previous video. Some people as young as 20 months old, some people in their 50s, 60s, and 70s, symptoms can appear in them. Symptoms can begin very rapidly when you become hot. And I would sometimes just merely walk into a room And if it was hot or a certain temperature, almost within seconds, I could start feeling the prickles come on and the stinging. And I would say, okay, you know, I've got to get out of this situation, or I'm going to face a really bad hives attack. And sometimes I would face hives attacks that were very bad. I can remember going into Walmart, and one time I went in and it was just so hot in there, I had to literally just turn around and go back in the car, and I just told my wife, you know, I can't do this. You're just going to have to go in without me. And there were a lot of times where, and it got to the point where I wouldn't do a lot of things because I would just know immediately. I wouldn't go in a certain store because I knew they kept it hot in there or something like that. It really just had a huge impact on my life. Sometimes I'd be in Walmart and I would feel a reaction coming. I would go and, you know, go to the freezer section and, you know, be like looking around in freezers and stuff, just trying to get that cold air on me to stop the reaction so that I'm not going to break out in hives in the store. And I would even work out a little code system with my wife, and I would be like, okay, you know, if you see me and I'm like at the checkout thing and you see me like scratching myself like this, that means I've got to go to the car. Or if I'm like, hey, I've got to go to the car, then you know I'm going there to scratch myself like crazy. And I sometimes would do that. I would run out to the car, and then I would just go crazy scratching myself. You can have multiple reactions in a day as well. And I think that is tied to the severity of your hives. A lot of people use what I'll call sweat therapy, or people refer to sweat therapy on the website, or exercise therapy. And when they do that, what they're doing is they'll go through in the morning, they'll exercise or get in a sauna or something like that, and they'll try to make their body sweat. And the idea is that if they can suffer through a reaction and just get through and kind of get some sweat out, that for the rest of the day, they won't feel those symptoms anymore. And that does work, and it helps a lot of people. And I'm going to have a whole video on that to tell you how that works. But some people can do that. Now, if you have a more severe case of hives, I don't think that the sweat therapy helps you that much. And I'm mostly referring to my own experience, and I have heard a couple other people who have tried it, and they've never really been able to break through. Some people have reported that on the site. And when my hives were really severe, I could not do this. Even wearing, I put a sauna suit on, I put a big bubble jacket on, like sweatpants. I turned the heater up. It's probably like 80, 85 degrees in the bathroom. I was in there with this whole get up on, exercising. I think I went for like 30, 45 minutes to the point where I just couldn't do it anymore. And I was just breaking out in such a severe reaction. I mean, it was horrible. I couldn't get any sweat out. But some people can do that. And I think, again, I think it's more connected with the severity of your symptoms. So you can have multiple reactions in one day if you have a severe case of hives. If you have a minor case, you may just have one bad reaction, and then for the whole rest of the day, you're okay, and you can kind of go through and you won't have that reaction. And if that's the case, then you know the sweat therapy video that I'll talk about later may help you kind of manage your symptoms from a day-to-day basis. And again, your signs and symptoms can change over time. Mine started out, it was just kind of flushing and itching, but I didn't really have the visible hives. Over time, it got worse where I couldn't sweat. I would get the pinpoint hives all over from head to toe. It was just horrible. And it went from, you know, a mild case. At first it was kind of mild, then it got severe, and then it went away for those few years. And when it came back, it started out kind of mild and got very severe towards the end. And this happens, by the way, and I've already kind of mentioned this, but it happens with a systemic increase in your body temperature. In other words, if I took a heating pad and just placed it on my leg, where that hot area is likely not going to cause a reaction on my leg, nor is it going to cause a reaction on my body unless my entire body temperature increased to the point of causing a reaction. And that's kind of important to note, because it's kind of like when your hypothalamus switches on. It's kind of like a thermostat in your house. You know, one room can be cold, another room can be hot, but if the whole house gets below a certain temperature, that thermostat kicks on and it's going to, you know, cool or heat your house. It's kind of that same way with cholinergic urticaria. You can have a heating pad on your leg or something and you're probably not going to get a reaction, but if your whole body temperature kind of gets to a certain point where your hypothalamus is going to click on and send the neurotransmitter signals down to make you sweat, then what's going to happen is you're going to have a reaction. This can also occur alongside other allergic disorders, and that's important to note too, because some people, when they're trying to identify their symptoms, they might get a whole bag of symptoms, and the reality is you may have two different types of hives. It's not uncommon at all to have cold urticaria and cholinergic urticaria, and some people on the website, at least I think 5 or 8 people maybe since I've been running the site, have reported having both of those. A lot of dermatology articles have spoken about how people can have different types of allergies occur concurrently like that. When you have a reaction, what tends to happen, I'll just kind of briefly explain the process. You'll have no symptoms at all. You walk in, let's say you walk into a super hot room. Okay, what tended to happen with me was I would just kind of walk into a room and immediately I would think, okay, it's hot in here. I've got to be on alert because I could have a reaction. And I would begin to feel a kind of prickling somewhere, maybe on my back or my face or my neck or my chest or something. And it would just kind of begin, and I would kind of scratch and just kind of try to be, inconspicuous. I would just kind of scratch like that, or, keep going like that. Maybe just every once in a while thing. And I would try my best to not stand out at all and just kind of scratch myself to take away the itching sensation. But you do that, and then it would kind of get worse and worse if I couldn't cool down. And eventually it would get so bad that I would just be sitting there in torture. And it's particularly bad when you have a reaction in front of other people because, it's really embarrassing and you look like you're crazy. And you can't explain it to people because people just simply do not get this disorder. You cannot tell them, look, I'm allergic to heat. People don't get that. So I would sometimes just say, I'm allergic to something in my diet or something like that. And that would help them to understand, which is true on my part because diet is the biggest factor. But, that kind of helps people to understand because people understand food allergies. They don't understand that you're allergic to heat. But once you start scratching really bad, this can happen, for 5 minutes, 10 minutes, depending on how long your reaction takes. And then it will finally stop once you either get cool or kind of once your body just goes through a fit and releases the histamine and you itch and scratch to death. Symptoms can kind of subside after that, after maybe 10, 15 minutes or something, depending on how severe your case is. It could even persist for, I don't know, maybe 20, 30 minutes, I don't know. Most of my reactions did not last longer than about 15 or 20 minutes because by that point I would either get cool in a hurry or I would scratch myself to death or whatever, and usually it would stop. Now once it stops, your skin will be red or you may have hives on it or something like that, and the itching and burning usually stops in most people, and all those symptoms that you had will begin to clear up within usually just like 15 minutes. Like I could have a reaction, be covered with hives and be red. 5 or 10 minutes later, I look perfectly fine. You could never tell anything was wrong with me. And that's why it's important, if you want to try to get a diagnosis from a doctor, to try to take a picture during a reaction so you can kind of take it with you and say, look, this is what's happening to me every time I get hot. Because when you go there and you look healthy, they're going to, be a little bit suspicious, or they're not going to believe you. And just as a side note, if you do go to a doctor to try to get a diagnosis, if you go to an allergist or a dermatologist, those are your two best bets that they're going to be familiar with this disorder. If you go to a general practitioner, they're probably not going to know much about it. So you're going to want to go to either an allergist or a dermatologist. That's who most people report on the website that have helped them. So that's what you want to go with. And that pretty much sums up this video. Those are the signs and symptoms. Again, I have pictures on my website if you want to look at some up-close pictures of what this looks like. In my next video, I'll talk a little bit about some of the causes or triggers with cholinergic urticaria. So I hope you stay tuned for that, and I hope you enjoyed this video. Thank you so much for watching, and God bless.